Good afternoon. Good afternoon, everybody. Good afternoon, and welcome on board. Welcome to week 2 of our session. We had week 1 the last week, and we're getting ready for week 2. We are in week 2. Welcome, everybody. Welcome, Ella Burrow. Welcome, Kenny Crown. Welcome, Dr. Chi. Welcome, everybody. I'm just going to give a few minutes before I kickstart the session. How is everybody? Happy Mother's Day. To those who are celebrating Mother's Day, happy Mother's Day. I know that we're absolutely great. Hello, namesake Tony. Hello, Eloise. Hello, Ola. Thank you so much for tuning in. It's going to be a great session. I'm assured it will be a great session. Hello, Kenny. Hi, Tammy. Thank you all for joining in. I did say happy Mother's Day to all the amazing women in the house. I'm sure you're being spoiled. I hope you're being spoiled. If you're not, send me a message and I'll deal with your household. My name is Toyin Toyin Oboro, and I am a diabetes specialist pharmacist. We're doing a 4-week series of different topics around diabetes. Last week we talked about diabetes in the wholeness of it. And this week we're talking about the eyes. We're going to be talking about diabetes and the eyes. There is so much that goes on in the eyes. I don't even know myself, but we have a specialist in the house that's going to dissect every minute of it. So I'm just going to quickly recap, for just 1 minute, about last week. If you didn't catch the series or you haven't had time to watch it, please feel free to catch up. It's on the on my page or on YouTube. You can find it at Diabetes Consults. We talked about diabetes, explained what it was, how it affects the body. A few people asked questions and we got time to answer it. So in this week, we're concentrating on the eyes. The eyes are very delicate and nobody wants to lose their eyes. Like maybe some people can have amputations, not that it's okay. But the eyes, when they go, they go. I don't know about eyes transplants. I guess Dr. Chi will be able to let us know. But we need to learn to protect our eyes. So we're going to be focusing on the eyes. We talked about diabetes affecting, according to the WHO, and I'm sure it needs to be updated. Diabetes affects about 420 million people. 20 million people living with diabetes. And yet there are quite a number of people who are still unknown to be diagnosed with diabetes. And then I did some research yesterday and I found out that from the WHO that about 2.6 million people are visually impaired due to a terminology called diabetic retinopathy, which is diabetes actually affecting the eyes. And they're estimating that by this year, they were going to get to 3.2 million. So that's a lot of people. So I guess today we're going to be covering how do we prevent that visual impairment from progressing, or how do we control things. And Dr. Chi is going to be in the house to explain it to us. So I'm just going to get Dr. Chi to send me a request. And while she's coming in, I'm going to give a brief introduction about who she is. So Dr. Chi is a UK certified and award-winning optometrist. It's a big word. She's a fellow of the American Academy of Optometry. She's a member of the College of Optometrists. And she obtained her doctorate degree in Nigeria. She obtained her postgraduate diploma in community eye health at the UCL in London. She has a postgraduate certificate in global health from the Harvard University. You are full of book. Is there any more reading that you don't want to do? Hello, Dr. Chi, and welcome.
Hello,
Thank you so much.
Toyin. Thank you for having
Thank
me.
you so much for joining us. It's such an honor to have you as a
My
platform,
pleasure.
and we're going to dig into the wealth of wisdom that you have.
Thank
So
you.
I was giving an introduction about the eyes. I don't know anything about the eyes. The only thing I know is what I learned about
when the optometrist or the ophthalmologist send us the reports, I know how to read that there's something wrong with the eyes. That's all. But if you
Yes.
ask me to look into someone's eyes, that person is going to go blind. So obviously you're the expert. So thank you so much for coming in on board. And I want to take time to welcome everybody else that has come in or joined us as we've started this session. So thank you, and welcome from Tonya
Thank
Burrow
you.
and from Diabetes Consult. Right. So Dr. Chi, a lot of people are living with diabetes, and they say, I don't know what you're talking about, us having an eye condition, I can see. I don't think there's anything wrong with my eyes. Is there any reason why people who have diabetes, why should they actually bother about their eyes if they're diabetic? And the blood glucose level, is it linked to the eyes?
Yes, very much, very much. Thank you for having me again. And yes, the blood glucose is directly linked, strongly linked, as a matter of fact, as research work says. Because when there's too much, either like in the type 2 diabetes where you don't have the insulin performing properly, it will cause a hype or a hike on the blood glucose. So this is strongly linked, as well as the duration of the disease. So
Mm-hmm.
when somebody is already diabetic, we don't know. And if you haven't had a regular side test, you don't know if this can, how long the person has had it, and you don't know if the person is going to be having diabetic retinopathy or not. Yes, blood glucose is strongly linked to diabetes, yes, and eye
Okay.
disease as well.
Okay, that's interesting. Now, we know that when people hear about diabetes, they hear, they obviously we tried to trash that last week. They think about mainly the sugar, which we try to say obviously that's important, and then we know that diabetes can cause what we call cardiovascular outcomes, which is relating to heart attacks, strokes, and things like that. I find that a lot of people, and obviously it can cause renal chronic kidney disease, which then leads to renal dialysis and things like that, which arises. But then that is the main focus of diabetes. Now, in what depth is diabetes related to the eyes? Because we hear diabetes, we think, and even in practice, I, as a clinician, I have to hand on heart say that the eyes are probably the last thing that I deal with, because I'm thinking, oh my God, your sugars are high. I need to make sure you don't have a heart attack. I need to make sure you don't get a stroke and things like that. How related is the eye condition? Like, can you explain to us how, because we've talked about, yes, it affects it, but can you please tell us in what great depth does it affect us?
Okay, I'm going to take us on a short and quick journey as well. And I'll come up to high blood pressure because that's a very strong predisposing factor to diabetic retinopathy. Now, when everybody's got eyes, definitely. So if somebody comes to me and there's a history of diabetes, I don't just jump to the retina. I think of the front of the eyes. And I'm looking out for things like, have you got recurrent sores on your eyelids? Are you waking up and having sticky discharge? Are you having dry eyes? Are you having difficult on movement of your eyes? Now, this might not look connected, but most of the time, patients with diabetes got what they call ulcerative blepharitis. They've got cornea problems where they have recurrent corneal problems that cannot be healed. They got dry eyes, and dry eyes simply means that you're not producing enough tears to lubricate the surface of your eye. And going down, you look at cataracts. You look at a lot of people who have cataracts. You're wondering, is it related to age? Some oftentimes not. If you've got type 2 diabetes, you're at risk of having what they call snowflake cataract. You're having glare problem in the evenings when you're driving. You've got, if you're wearing glasses, you do notice, I just changed my glasses last month and it's going to be difficult. I'm beginning to have difficulty again. Your eyes are changing because of the fluctuation of your blood sugars. And then, of course, if you've got blood pressure, that also is a trigger because that blood pressure, your heart is connected, because when I look at the back of your eyes, I look at the vessels, they're not looking normal. They are very thin. And diabetes mostly affect small vessels called capillaries.
And these capillaries, when they get inflamed, they bleed, they swell, and they release fluid into the eye. And that's where your retinopathy kicks in. The retinopathy on its own could be non-proliferative, which means it's not progressing, but it's little bleeds. But along the line, depending on how old the diabetes is, these bursts and release fluid, causing what they call macular edema, causing what they call maculopathies. And that's where the blindness stage, visual impairment sets in. So if you've got high blood pressure, if you've got high cholesterol, you are strongly linked to having diabetic retinopathy. You're strongly linked to possibly going blind, because diabetic retinopathy is also a very strong cause of blindness. I don't know if that's answered some of your questions.
It does. I'm trying to write down so I can take you back a little bit of a step. Now, you talked about cholesterol. Now, I want to know how cholesterol, which is linked to your arteries, I guess I can, as a clinician, think about it. How does it relate to the eyes? Like how is it linked? Obviously, because we talked about it last week. We covered that we don't just look at diabetes in terms of just the sugars. We look at it in terms of your blood pressure. We look at your cholesterol. We look at your sugars, and then we look at your diet. So we try and like manage all of this. So how exactly is the cholesterol linked to the eyes when most people feel like the arteries are around the chest region? So how does it go up to our eyes?
It does link up, because in the retina itself, the retina is made up of arteries, veins, and capillaries. And the capillaries are the small ones. The veins and the arteries itself can be affected by things like atherosclerosis, which is where the cholesterol comes into. So that atheroma, sometimes it blocks the vessel itself. And when there's a blockage of the vessels, we do notice it. It's oftentimes when we do what they call ophthalmoscopy, or when we do using Volk lens to look at the back of the eye, you can actually, in some cases, see those hard exudates, as we call them. And these hard exudates will block the eye. And in a particular case where you've got diabetic patients, when there's a blockage, you can have what they call vein occlusion, retinal vein occlusion. And the vein occlusion could be superiorly located or inferior located, and they will cause massive bleeds. And these massive bleeds in the eye, if you're already diabetic, you're prone to bleed, because the capillaries are bleeding already. They're broken down, they release fluids in the eye. So a combination of those predispositions would complicate your status as a diabetic and also increase your risk to blindness. So your risk to hypertension or cholesterol problem would now increase your risk and make it even worse. That a person would have what they call retinal detachment in some cases, where there's a scar tissue formation in the retina, and that will create, I'm trying to simplify it, with fibrovascular systems, where you have scars, and those scars, they pull the retina together. And when this happens, you do a shutdown, because the patient will notice flashing lights or floating specks, and oftentimes they're not. They are sudden visual losses. So when you have this sudden visual, you need to come and see me as an optometrist, or if I'm not available, you need to go to A&E or report to your GP. We've got all those emergency facilities available. Yes.
Wow, it's obviously you've made me as a clinician now understand, like when I'm seeing the patients in the practice, that I would not just leave their eyes to the end and just say, have you had your eye, because I just say, have you had your eye test? And they go, yes. I'm like, okay, you've not had it. But from your explanation is showing that there is an importance of actually ensuring, because here in the United Kingdom, I don't know about anywhere else in the world, we advise that every diabetic patient, everyone living with diabetes, rather, should make sure that they have an eye test, once a year.
Correct, yes.
Right. You've mentioned some of the symptoms, of the diabetes. You mentioned diabetes related to the eyes. You mentioned recurring sores. You mentioned sore eyes, dry eyes, sticky eyes. blepharitis. Now, can you explain what blepharitis is? Because to somebody on here, they're like, how am I supposed, I know about sore eyes and sticky eyes, but please tell me, how do I know if I'm getting blepharitis? What is it?
Now, blepharitis is really simple. The eyelids, I call them the windows, the wipers of the eye. That's why I call your eyelids, you know, those little windows I'm touching. Those are your eyelids. And those eyelids got, you know, some lashes attached to it. And then there's small vessels aligned on the edge of those vessels. Now, they can easily get infected with little supposedly commensal organisms which stay in the eyes. Commensals is not a big word, but they are natural germs that thrive in the eye. They don't harm you. They don't cause any infections. But if you've got something like diabetes, it will trigger infections. And some of the infections, especially of the eyelid, with you have ulcers that cause an inflammation, a swelling of the eyelids. So blepharitis is simply swelling of the eyelids related to an infection.
Interesting. Interesting. Yeah. So we've been talking about, thank you for clarifying that. You know, it's really
You're welcome.
because for us, we understand, and any other clinician on here, but for simple terms, you know. So when people are actually getting swollen eyelids, sore eyelids, especially if you're diabetic, do not ignore it. If you're getting floaters, if you're getting snowy, how do they know if they have the slow flake cataracts? How would they know what symptoms?
It will come to them in form of blurred vision.
Okay.
And cloudy vision. Cloudy is actually the right word. Cloudy vision. And they're cloudy vision that can't easily be resolved. So you just notice your eye suddenly goes hazy, cloudy, and you don't know the cause. You probably think, oh, let me wash my face, or everything seems cloudy, even in bright daylight, then it's suspicious.
Yeah, that's really good. You know, I can never reiterate to someone who's living with diabetes the importance of looking at the holistic picture. So, you know, like you get people thinking, oh, I only need to look at my diet, or no, once my sugar is down, that's all that I need to do. But obviously, we're learning, and we're going to go through the entire 4-week series, you know, about the fact that everything in terms of diabetes amalgamates together. You know, like your sugars, your high blood pressure, your cholesterol level, and the eyes, because the higher they are, you know, the more they're causing unknown damage to you, because you can probably see, you know, but then you have to, once you start blinking your eyes, I guess, or you start trying to clear, you can't see properly, you need to find an optometrist, or like Dr. Chi says, that you need to make your way to A&E. Now, apart from, you mentioned earlier diabetic retinopathy, okay?
Yes.
And you kind of explained it a little bit. You kind of just touched on the door. Can you please, you know, even to us as a clinician, what is diabetic retinopathy?
Wow, it's a big thing, diabetic retinopathy, and it's one of the leading causes of blindness. But the chances of going blind from diabetic retinopathy is actually doubled if you're already diabetic, and or if you've got glaucoma, for instance, and I'll come back to that. Diabetic retinopathy simply means that the blood vessels that supply the retina, like the small vessels, the capillaries, that they now begin to damage. When they damage, because they are quite small, and this is right at the inner part of your retina, it breaks up. You know, there are different layers. It's supposed to be thick. And when those layers break up, they release some fluid. This fluid gets into the retina, especially the light sensitive part of the retina called the macula itself, the macula fovea centralis. When this gets in there, it causes what is called macular. The macular edema is oftentimes, first time you might not see it on ophthalmoscopy, but if you have what they call OCT, which is an eye scan, you might see the elevation of the retina due to the fluid already layered under that, you know, on that microscope. Then it can progress and degenerate from that into maculopathy itself, which is where new vessels form on the macula. But that is extreme stage. Early stages, you've got what they call background stages, where you have cotton wool spots, you have little red dot blood hemorrhages scattered all over. That oftentimes will keep it monitored. But when it gets to the stage of macular edema, where there's a swelling, then it's time to refer. And then worst stage, when it becomes maculopathy, where new vessels growing in on the macula or in the retina itself, which can lead to retinal detachment and scar tissue formation, then that's a code red. We need to urgently refer and then look after it. So that's your diabetic retinopathy. It literally means swelling of the retina in relation to diabetes due to inflammation or damage of small capillaries.
Wow, wow. I'm learning a lot. Which is good, which is good. Thank you. So we've talked about the symptoms and you talked about the code red. Are there any other, before I go back to the glaucoma, are there any other, while we're talking about code red at the moment, are there any other symptoms that someone has that they need to make sure that they make their way to emergency services or to an ophthalmologist? That's always a mouthful for me, or an optometrist. Are there any other severe symptoms that we should know about?
Okay. Diabetes, retinopathy, for instance, especially if it's not been diagnosed, does not give you any symptoms in the first instance. But if, for instance, you've not worn glasses before and you suddenly have a sudden change in your vision that requires glasses, that is something, I wouldn't call it a code red, but it would attract the attention of an optometrist, and then we can review your sight. And if I review your sight and I say, I want to see you back in 6 months, 12 months, in often cases 2 years, and the prescription changes within 3 to 6 months, that is suspicious. If it keeps fluctuating, so the irregularity of your prescription would place you on a suspicion. And if I do test you again, I find out you used to be -1 diopters, for instance, which is a prescription for a short-sighted person, changes to a -2 and goes back to a -4 and changes, then there's something wrong. Then I would recommend a blood workup to go and have your blood sugar tested. And obviously, 9 out of 10, they come back with, oh, my doctor said I'm diabetic. So when I see, that's a basic test, especially for somebody who's already wearing glasses. So it's just a way of finding out, and then I refer such a person.
Okay, thank you for clarifying. There are a couple of questions coming through. I've made a note of them, and I'm going to ask you at the end. Now, let's reverse. We talked about reverse. We talked about glaucoma. Okay, now, obviously we know about glaucoma. How is glaucoma and diabetes related? How are they related? Diabetes and glaucoma, wow. How are they related?
Glaucoma is, I love glaucoma, talking about glaucoma. The reason I love talking about it is because it's one disease that affects people of color, you know, the people of Black ethnicity. Glaucoma on its own in diabetes is of a secondary impact. And what I mean by that is the glaucoma is a factor that comes into play when you have diabetes. And the type of glaucoma most diabetics would have is what they call neovascular glaucoma, which is a secondary glaucoma. In glaucoma, you have the primary and the secondary. So it falls under the secondary. And why is it secondary? Long-term disease is an issue in diabetes. So if I don't know you've had it for 10, 15, 20 years, you could have your iris could now have new vessels growing on it. And that new vessel would create like a carpet, you know, like seaweed carpet on your iris. The iris is the black colored part of your eye that allows light to come in. It kind of affects the pupil. So when your iris has blood vessels on it, it will block the channels, the angles, the anterior chamber angles. The angles are I'm just looking for the simple words, is what affects the inflow of the aqueous humor, which is a fluid that controls whether your pressure is high or low. So if this carpet of red blood vessels block those chambers, automatically your eye pressure go up, and that would lead to neovascular glaucoma. So that's where the glaucoma comes into play in diabetes. It mostly occurs in older, long-standing sufferers of diabetes.
Okay, wow, that's really good. Thank you so much for clarifying. Now, I'm going to obviously have 2 more questions for you, and then I've got 3 questions that people have asked that I would ask you. If you have any more questions, obviously do send them through. Now, what if somebody already has a loss of vision from diabetes? How and how do they manage it? You know, like you've lost some form of vision or anything, and people are obviously scared of going blind and they're diabetic. How do you advise that they manage it?
Okay. Now, for me as an optometrist, the loss of vision have certain classifications. It depends on how much the level of vision you are seeing. Because definition of blindness or definition of loss of vision could be I can't see enough to drive, or I can't see my television, or I can't see my food. If it's those levels, we can still probably correct. But if it's loss of vision associated with either macular edema, which is a swelling of the macula, or associated with a damage of the optic nerve, like optic neuritis, or maculopathy associated with the scar tissue, they are not reversible.
Yeah.
That is the blunt truth. That is not reversible. But what we can do is to rehabilitate. But oftentimes, people don't lose two eyes at a time. Somebody might lose one eye. So if you lost one eye, maybe you had retinal vein occlusion and you lost it, or you had maculopathy and you lost it, then we have to make sure that the second eye is saved, which means there will be an intensive treatment if there's any bleed in the other eye. So, but if you've already lost it to maculopathy, it's going to be difficult to repair it. Yes.
That's good. The questions are flying in and I'm trying to keep up,
Okay.
which is good. Thank you so much for clearing that out. So now my last question for you before I go to people's questions is, oftentimes I hear people say, I'm diabetic. I want to use my diet and lifestyle to control my diabetes, which we encourage. Whether you're on medication or not on medication and diet control, we always say, please, adjust your diet. And in our subsequent series, I'll be bringing on hopefully a dietitian, if I can convince her to come on with me, to talk about diet and diabetes, really somebody who has the knowledge. Now, does diet and lifestyle affect the eyes? If they adjust their diet and their lifestyle, does it have a turn effect on the eyes?
Honest, I couldn't just sit and say yes or no. But what I can say, yes, if you look after your diet and then you improve your blood sugar levels, yes, that will impact on your eyes subsequently. So the most important thing is look after what looks after you. Which means if you see your dietitian, your diabetician, and they say to you, eat this and it's going to drop your blood sugar level. Remember, your blood sugar level has strong impact on the diabetic retinopathies and all the eye impacts. So important thing is to look after your food, look after what you're meant to look after, and then your blood sugar level will reduce. Then your short-sightedness will improve, and the risk of cataract will improve, and your recurrent infection on the eyelid obviously will improve, and even the optic neuritis takes about 3 to 6 months to go away. So yes, when you improve your food, improve your blood sugar level, then you will get healthy eyes. Yes.
I have to clap for you. Sorry. I felt like
Thank
that
you.
needed a clap, a round of applause.
Thank you.
Thank you so much. So that's the end of my questions, but I have quite a few people throw some questions. Now, somebody wanted you to clarify the effects of diabetes on cataracts. I think I got that question
Okay.
right. Yeah.
Effects
Yeah.
of diabetes on cataract.
Yeah, or
Cataract
how
is
I think that's the question. I think so. Yeah. Just really knowing either how cataracts affect diabetes, or I think mainly how diabetes affect or leads on to cataracts.
okay. I probably won't go into too much technicalities, but what I know is that the diabetes, the type of diabetes that we have in cataract we have in diabetes, I beg your pardon, is senile form of cataract, and it could start at a younger age. When you hear the word senile, what jumps to your mind is old
Oh,
age. But it's not necessarily in case of diabetes, because that's where you have what they call the snowflake cataract. And because diabetes is a metabolic disorder, so anything that affects your metabolism will trigger changes in the functionality of how the fluid balance in the eyes are, especially the aqueous humor. The aqueous humor supplies nutrients to the lens itself. The lens, crystalline lens, it's got no vessels on its own. It's supposed to be clear. So when there's an imbalance due to your blood sugar imbalance, automatically the lens itself would suffer because it's not getting enough supply or support, if I may use. So automatically, instead of you developing cataract when you're 70 or 80, it changes. The narrative for cataract changes. So you develop cataract maybe at the age of 30, you develop cataract at the age of 12 because you're suffering from this imbalance. So that is just the only non-technical way to describe that. Snowflake cataract, it looks like snow. And I know there's no snow in Africa, but snow is just the ice crystals that you can get. But it comes forth as a cloudiness, unresolved cloudiness of your deposition on your lens capsule, and you can't see very well. And of course, the resultant effect is that you would have to undergo surgery if the vision goes very low, because cataract is #1 leading cause of blindness, according to World Health.
Wow, wow, so insightful. Right. Thank you so much for that. The other question someone had was, now the way diabetes affects the eyes, is there a difference between how diabetes affects people who are type 1 diabetic and people who are type 2 diabetes, or is it the same? Because type 1 diabetics, obviously we covered that last week. So if you missed off the session last week, you can catch the replay. But it's literally where the pancreas does not produce the insulin anymore. That's the summary of it. Now, does the type, so to say, of diabetes affect the grade of
diabetes?
The results on the eyes.
Okay, the only way I would try not to, go beyond my competence, first of all. So because as a professional, I will keep within my limits and my competence. And within my competence, I know that what we bother about as optometrists is what is impact of increased blood sugar on your eyes. So if, for instance, in a type 1 where you're not even producing insulin, if it triggers an increase in your blood sugar, then it will follow the same mechanism of action. So within that level, I would just stick to, the best thing is to, when you think you have a type 1 diabetes, come and see us. Then I will look in your eyes and see what sort of things you're going through, because everybody is different. So you could have more things than others. You could have more cataracts. You probably could have more neovascularizations, or you could have more macular edema starting off earlier than it would start in a type 2 diabetes. So I think that's where I would, because I haven't got any research work to back myself. So I think I'll stick within my competence.
Yeah, we always stick within our competence. We're taught in the first world or the developed world to stick within your competence. But your competence level explained what we needed. So thank you very much.
You're welcome.
Right. So someone did ask earlier, and I would answer this question: is diabetes reversible, and how can they prevent that? We covered this in week 1. So if you missed the week 1 session, please catch that, and you will be able to follow it through and obviously get the explanation for that. Now, we covered the question around, somebody asked as well. Now, HbA1c is how much? I need to explain to people before I ask the question. Somebody said, are there HbA1c thresholds that these conditions begin to develop at? Now, HbA1c in simple terms is you got your red blood cells, and it's how much sugar is or glucose or sugar is encapsulated within that red blood cell. And the higher your level of HbA1c means you have more sugars. So without trying to draw, and I will draw, I did want her not to draw. I did want her not to draw, but if you had, for example, simple terms, HbA1c that is low, you would have less sugar in there. If you have higher HbA1cs, you have more and more and more and more glucose concentrated within your red blood cell. Now, the question from this person is, Is there a threshold? So at what point does the eye conditions for people living with diabetes, at what point does it start? Is there a point, does it affect people at different points in their HbA1c levels? That's the question.
Okay, I don't deal with HbA1c in the first instance,
I
because when
do.
they come, I don't deal with them because I don't run the lab. They don't even bring me their lab results. But some people who come to us, they've had diabetes probably for 17 years, for 15 years. I'll give you an instance. I saw a patient who was 75, for instance, and the first time he's having a situs was at the age of 75. And when I
Wow.
saw him, I saw everything in the eye. How did he come to me? He went for Polacar, which is one of our protocols for checking for diabetes and screening. Went to Polacar and they said, go and see your optometrist. 75-year-old man. He's got diabetic retinopathies. He's got macular edema. He's got maculopathy of all kinds. And he was reporting flashing and floaters. He had swollen disc. What do? I've got to report straight away an emergency. So the thing is, he's everything on the book, he's flagging red all through. So we don't deal, as optometrists in the UK, for instance, I don't deal with the lab results, but I deal with when were you diagnosed? How long have you been diabetic? What is your blood sugar level? Because they will know. And when they tell me the blood sugar is still fluctuating, I don't give glasses. Because if I give you glasses when your blood sugar is fluctuating, it's rubbish because you wouldn't see. You're going to come back next week and say the glasses don't work. So I don't want to give you glasses when it don't work and you come back in a month saying I need new glasses. So we wait till the blood sugar level is stabilized, and that's where I step in. And if that's linked with your HbA1c, then it means I want you to have it at a normal level first before you come and see me.
Yeah, we often get people get sent back in practice, like I get the patients ringing me frantically saying, you need to help me bring my blood sugar down. I've got surgery in 3 weeks. And I keep going, I'm not a miracle worker. I can't bring you from there to there. It takes time for us to bring the levels down. So I understand. So I guess the answer to that possibly is at their thresholds. Like we said, we say in practice that sometimes people say, but I feel fine, I don't have diabetes, or I don't think I have diabetes, I eat well, I sleep well, I exercise. We always say that sometimes it can take up to 10 years for you to get diagnosed with diabetes, and it can be in your system. We covered all of that last week, so I don't want to go into all of that this week. But if you are diabetic, or you have a family member, or you don't even know if your family members have diabetes, please get yourself checked. Don't be frantic and check every month. Check at least 6 monthly, or at least once a year or once in 2 years as the normal routine. For those of us who wear glasses, it's like having our fingernails done. We have an appointment, we go, we get checked. So please make an appointment. Don't think that diabetes is what's the eyes. It's not related to the eyes. It is very, very, as we've heard today, related to the eyes. Now, I can't see any more questions. And I think that we've covered it all. So I'm going to keep you online as I wrap up, Dr. Chi. I like someone staying with me while I wrap up. Thank you so much for coming on and explaining. You really dissected it. In human anatomy, we call it dissecting, where you pieces the whole work, and you did that. So I'm giving you a thumbs up, or a knuckle, as they say. So thank you so much for coming in. Next week, we are continuing the 4-week series. We've got another Dr. Toyin. Yes, I'm a duplicate. There are many of us. Who's coming to cover mental health. Now, that's a lot of topic people are in denial of. You feel like it's got nothing to do with diabetes, but it's a lot to do with diabetes. So please, next week, Sunday, same time, please make sure that you tune in. I've got one question here. Hang on, someone's just sent in a question. Oh, it's a statement. HbA1c below 40. Hang on, HbA1c below 40 in an adult, above which your risk end organ is higher. So obviously someone is saying HbA1c, if the level is above 40, then your risk of end organ damage is higher. So we need to obviously try and bring that that down, which I do agree with. So thank you so much. So thank
Can
you,
I just
Dr.
add one
Chi.
more thing before
Yes,
you
by all
finish?
means.
In the Kent region, if you're in the United Kingdom, we have what they call Polar, and it's a diabetic screening protocol, which means if you're registered with any GP and you haven't still seen the protocol for screening, I would suggest you report straight on to your GP, because even as an optometrist, I see you, that protocol, I'm not covered. I can dilate your eyes, put some drops and look at the back of your eye, but it's very important that you have an annual check, especially with the COVID-19 going on. Please do not play with your eyes. I can see you as an optometrist, but you need to be part of that protocol where you get seen annually. And that's when they can pick up if there's anything they can refer to us or refer to for surgery or anything else. And for an optometrist, if you're already having diabetes, we test you every year and sometimes 2 years, depending. So that's all I wanted to say.
Yeah, thank you so much. I would add to that to say it's not just diabetes. Yes, our name is Diabetes Consult, but if you also have high blood pressure, there is an effect on the eyes. So you need to see
Yes.
an optometrist. Don't just think I'm taking my blood pressure medications. They're all intertwined one way or the other. You may not have diabetes, you may have high blood pressure, you may have what we call familial, in simple terms, I don't want to use the name. You might have a family history of high cholesterols, or you yourself have high cholesterols. We've heard you today that cholesterol, raised sugars in diabetes, high blood pressure are all interlinked, all glaucoma. So whether you have one of these conditions or not, please make your way to get your eyes tested. You don't have to go to Dr. Chi. She's all the way in Canterbury. No, where do you practice? In
Prostate.
that's it, Broadstairs. So obviously make your way to your doctors, or your optometrist and get your eyes tested. If you're in the United Kingdom, please make your way to it doesn't have to be doctors, because these days the general practitioners are either leaving it to mostly the nurses, or in certain practices where you have pharmacists like myself, we look after people who are living with diabetes, type 1, type 2, whatever type of diabetes you've got. So please do not ignore your eyes. Do not ignore your health. They say health is wealth. You have a lot of money when you're healthy. So stay healthy, everyone. I will see you next week, Sunday, same time at 3 o'clock with a different speaker. Thank you so much, Dr. Chi. I really appreciate it. Thank you so
Thank you
much.
too.
Have a good afternoon, everyone, and happy Mother's Day to all the mothers in the house. Thank you,
Thank you
Dr.
for
Chi.
having me, and happy Mother's Day to you too.
You're welcome. Bye. Bye.
Bye.